Hi, I'm Steve Sabus, Senior Vice President and Head of Oncology Business Unit at Astellas in the US. I'm here with Phil Tennant, our Senior Vice President and Global Head of Oncology Marketing, as well as Ahsan Arozullah, who is our Vice President of Medical Sciences Oncology. This year marks the 63rd American Society of Hematology annual meeting and exposition. Phil, Ahsan, and I are here virtually to highlight the data being presented across Astellas Oncology's growing portfolio.
That's right. And while we may not be there in person to present our data, we are still very excited about sharing our research insights, scientific advancements, and key learnings with the oncology community to further demonstrate our commitment to advancing solutions for difficult to treat hematological malignancies where often there are few treatment options.
That's exactly right, Phil. And with that, why don't we jump right into the most recent investigational data that we'll be presenting at ASH this year, which speaks to the breadth of our program across the FLT3 mutation positive acute myeloid leukemia patient continuum. Ahsan, can you provide some of the highlights we'll be discussing at ASH?
Sure, Steve. At this year's meeting, we will be sharing data from a total of 11 abstracts, focusing on AML, including 3 oral presentations led by Astellas, and 1 where we are a collaborator, making this Astellas' largest ASH showing to date. Additionally, we are a collaborator with the Leukemia and Lymphoma Society on a presentation focused on the BEAT AML master trial. Highlights include an oral presentation on results from the phase 3 LACE-WING trial in newly diagnosed patients with AML who have FLT3 mutations and are ineligible for first-line intensive induction chemotherapy. We will also present results from the phase 3 Commodore trial, a trial conducted mainly in China. We will also be presenting research based on patients' perspectives of AML symptoms, life impact, and treatment. More specifically, one study will present the patient experience after a stem cell transplant, which can inform efforts to better serve patients post-transplant. In addition, we are presenting new preclinical data on sickle cell disease for a novel BOC1 inhibitor that potentially induces fetal hemoglobin. The data shows potential to increase expression of antioxidant and fetal hemoglobin genes and reduce sickle cell disease-related pathophysiology. Finally, in collaboration with AbbVie and Genentech, results will be presented from a study evaluating the efficacy, safety, and tolerability of a combination study for the treatment of relapse refractory FLT3 mutated AML.
Thanks, Ahsan. Astellas' presence at ASH certainly continues to grow every year. More importantly, we're very encouraged by both the breadth and the depth of our data. It truly signifies Astellas' commitment to fighting AML as we seek new treatment options for patients, whether they are relapse refractory, newly diagnosed, and through varying combination regimens.
We're both proud of the effort that went into bringing these results and this deeper understanding of AML to such a critical meeting. On that note, I want to recognize the tremendous effort by the Astellas team, but also, and more importantly, I want to thank the physicians and the patients who have participated or continue to participate in our clinical trial programs. It is really encouraging to witness the work that's being done as we continue to pursue targeted therapies for hard-to-treat cancers where few therapies exist.
That's right. And for those of you who can make it to the meeting in Atlanta, please do visit our booth, which is number 2623. Attendees can also interact with our virtual booth to learn more about the information that we're presenting at ASH.
Thank you, Phil and Ahsan. It's always a privilege to participate in the conversation at ASH, which advances the discussion around hard-to-treat blood cancers, the field of hematology, and in particular, AML. Making a positive impact on patients' lives is the purpose behind everything we do. Again, if you're visiting ASH, visit our booth. If not, we hope to stay connected. And until then, I want to close by wishing everyone a great ASH meeting.